So my name is Doris Hansen from Moffitt Cancer Center. Today we'll be discussing a bit about the cost per responder analysis among lenalidomide-refractory multiple myeloma patients treated with Cilta-cel and CARTITUDE-4. So Cilta-cel, or ciltacabtagene autoleucel, was FDA approved in 2022 for patients with relapsed refractory multiple myeloma, and it has shown superior efficacy in comparison to physician's choice of DPD versus PVD in terms of progression-free survival, overall response rate, as well as complete response or better. So the objective of our study was really to assess the true value of Cilta-cel versus physician's choice, not only accounting for clinical effectiveness, but also for economic benefit of this therapy. So we essentially set out to perform a cost per responder model. We used a mixed payer source, commercial and Medicare, to assess costs associated with this therapy, in particular costs associated with drug acquisition, apheresis, lymphodepletion costs, infusion costs, bridging costs, as well as management of toxicities, subsequent therapies, and prophylactic antibiotics. We created a model that compared total cost between Cilta-cel and physician's choice. We also compared cost per complete responder and cost per month progression-free survival over a 25-month period, because that was the maximum time that a patient on physician's choice remained on the treatment. And essentially, we identified that the total cost was approximately $700,000 versus $800,000 in Cilta-cel versus physician's choice. Cost per complete responder was $1 million versus nearly slightly over $3.5 million in Cilta-cel versus physician's choice, and similarly, the cost per month in PFS was approximately $30,000 versus $40,000 for Cilta-cel versus physician's choice. So essentially, seeing that with Cilta-cel, there is economic benefit, particularly in patients who have a complete response or better. We also did a scenario where 30% of patients were treated in outpatient setting, which is a more common practice, especially in the large academic medical centers, and identified similar findings with economic benefit for Cilta-cel. So essentially, we're hoping that our study will be helpful, particularly to payers, in the sense that they are able to assess the true value of these novel immunotherapies when accounting for clinical benefit, but as well as economic benefit. And obviously, our study did demonstrate that Cilta-cel is associated with significant benefit, in not only clinically, but also an economic benefit for patients with relapsed refractory multiple myeloma. Thank you very much.